What do you know about dopamine? What do you know about dopamine history? What do you know about dopamine chemistry, synthesis, metabolism? To know all these things, you have to listen to today's episode where we are going to talk about dopamine. Welcome all to Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Dopamine was first synthesized in 1910. After that, biological, peripheral properties of dopamine, they were worked up by Sir Henry Dale. It was discovered as a quiet, weak, adrenaline-like substance. Further later, around 1930s, it was established that dopamine occurs as an intermediate link compound during the synthesis of norepinephrine and epinephrine. Further later, around after 20 years or so, dopamine stores, they were discovered in the tissues of body. Yes, it was established as an important signaling neurotransmitter now. Then Sir Ole Horny-Q-Wicks researched the deficiency of dopamine in patients suffering from Parkinsonism disease. It was indispensably established now that dopamine is an important neurotransmitter in the neurological pathologies and disorders like Parkinsonism. Now let's understand the chemistry of dopamine in brief. Dopamine consists of catechol moiety connected to ethylamine, and that is how is formed catecholamine. It's readily oxidized to form cytotoxic reactive oxygen species and quinones. These make up the main constituent of the Lewy bodies which are found in the Parkinsonism disease patients' brains. Now let's understand the synthesis and metabolism of dopamine. The main precursor of dopamine is phenylalanine and tyrosine. Phenylalanine is converted to tyrosine with the help of phenylalanine hydroxylase. For your kind information, I should tell you that phenylketonuria is a condition which occurs when phenylalanine hydroxylase decreases in amount, and that in turn increases the quantity of phenylalanine in the body. Now this condition of phenylketonuria, it actually can be well managed by diet monitoring and restrictions. Another fact that you should know is that tyrosine can easily pass through blood-brain barrier. Tyrosine hydroxylase converts tyrosine to L-dopa. This is the rate-limiting step in the synthesis of dopamine. L-dopa rapidly converts into dopamine. L-dopa can readily cross the blood-brain barrier, while dopamine cannot. Now let's comprehend the metabolism of dopamine. Monoamine oxidase primarily metabolizes dopamine and it generates inactive aldehyde derivative by oxidative deamination. Further, this aldehyde derivative converts into 3,4-dihydroxyphenyl acetic acid, that is abbreviated as capital DOPAC, catechol O-methyl transferase, that is abbreviated as capital COMT, further metabolizes DOPAC and then is formed the homovanillic acid. In human beings, the homovanillic acid is the main metabolite of dopamine. So, now you should remember very well that DOPAC, homovanillic acid, and dopamine all are excreted in the urine. By measuring the ratio of DOPAC and homovanillic acid to dopamine in the cerebrospinal fluid, one can accurately show the brain dopaminergic activity of a particular individual. Now this whole discussion leads us to another fact. Monoamine oxidase B selective inhibitors like selegiline, rasagiline or cyanamide can actually enhance the levels of dopamine and are recently very good medications for the treatment of Parkinsonism disease. Catechol O-methyl transferase, that is capital COMT, can also metabolize L-dopa to 3-O-methyl-dopa. Now this 3-O-methyl-dopa can actually compete to enter the blood-brain barrier with L-dopa. For this particular reason, you should always remember that L-dopa, whenever it's given for the treatment of Parkinsonism disease, it must be given along with the peripheral COMT inhibitors like capon and opicapone, so that maximum entry of L-dopa can be facilitated inside the brain. Now let's pay some heed to dopamine neurotransmission. After the synthesis, dopamine is packaged in the secretory vesicles by vesicular monoamine transporter, which is known as capital VMAT2, VMAT2. Reserpine drug can inhibit VMAT2 and it can decrease the dopamine levels. And for the same reason, in very yesteryears, yes, olden times, this reserpine was used for the treatment of psychosis. Benazine is another VMAT2 selective inhibitor. Now this benazine is very popular drug for tardive dyskinesia. In the condition of tardive dyskinesia, involuntary movements can occur. And the possible proposed mechanism, which is not yet very clear, but it is possibly the most proposed mechanism, is dopamine hypersensitivity. Inside the storage vesicles, dopamine is converted into norepinephrine by the enzyme beta hydroxylase. And further in the adrenergic cells, it converts into epinephrine with the help of phenylethanolamine N-methyltransferase. Once the dopamine is released into the synapse, signal transduction occurs, and that occurs with the help of G-protein coupled pathways. And along with that, independent signaling is also there. There are presynaptically expressed dopamine receptors, and once they are stimulated, they can regulate the dopamine synthesis by the feedback mechanism. Reuptake of dopamine leads to the termination of dopamine action. That is a very important point which you should know. Dopamine transporter, DAT, capital DAT. It is present in rights, axons, and peripherally also. It is found in stomach, pancreas, lymphocytes. Cocaine is one of the drugs that acts as an antagonist to block the reuptake of dopamine, and it actually potentiates the signaling of dopamine. Amphetamines is a substrate for DAT, that is capital DAT, and also amphetamines are substrate for VMAT. The result of this thing is the increased cytosolic dopamine concentration. Amphetamines can target a new receptor in the dopamine neuron, trace amine associated receptor 1, which is abbreviated as TAAR1 receptor. Once the G-protein coupled receptor pathways they are activated, the cyclic AMP it increases. Psychostimulants like cocaine, amphetamines, methamphetamines, they can cause euphoria and hyperactivity by increasing the extracellular dopamine. Now, after the uptake of dopamine in the dopamine neurons, reactive oxygen species like superoxide radicals they are generated. And these reactive oxygen species, they can actually cause the neuronal death. Now this selective dopaminergic degeneration, it serves for an important study in the animal models of Parkinson's disease. With this information about selective degeneration serving as important animal models for Parkinson's disease, I cease my talk, wind up today's discussion with a little hint of next episode in which we're gonna cover dopamine receptors. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also subscribe to a free monthly e-newsletter of mine, the Pharmacology Further e-newsletter. It contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. All are with the same name is Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.